Most vaccines have been in use for decades, with millions of people receiving them safely every year. As vaccine technology advances, researchers can develop better and safer vaccines. The complexity of vaccines, tonight on Call with the Prairie Doc.
Welcome to On Call with the Prairie Doc, health information based on science, built on trust. I'm your Prairie Doc host tonight, Debra Johnston, and we're going to be talking about vaccines. Vaccines are complex biological products that contain various components such as antigens, adjuvants, stabilizers, preservatives. The development of vaccines involves a thorough understanding of the immune system and the specific pathogen being targeted. The manufacturing process of vaccines requires strict quality control measures to ensure safety and efficacy. Vaccines are often tailored to specific populations or age groups, taking into account factors such as immune response and potential side effects. Thank you for joining us this evening as we will discuss vaccines and answer questions. This evening, we're joined in the studio by Dr. Amy Cook from Sanford Brookings Clinic and Dr. Ashley Sands from Sanford Children's Specialty Clinic in Sioux Falls, South Dakota. Welcome, you guys, and thank you so much for joining us. I'm excited about this show. It's an important topic, and it's going to be great.
Thank you for having us.
Yeah. Dr. Sands, I want to start with you. Tell us a little bit about your background, what you do, and how you came to do it.
Sure. So you mentioned it. I'm a pediatric infectious diseases doctor. I grew up on the Northeast, Boston, New York, that area. Went to medical school at Ross University in Dominica before doing my pediatrics residency and chief residency in Baton Rouge, Louisiana. After that, I went back up to New York and completed my pediatric infectious disease fellowship at Cohen Children's Hospital on Long Island. And then came out here to South Dakota, and I've been here for the last year and a bit, working at Sanford and taking care of our pediatric patients all throughout the state.
Fabulous. It's such an important thing, and boy, talk about an area that vaccines are super important for. Pediatric infectious disease has to probably be the top of the list.
Absolutely.
Absolutely. Dr. Cook, tell us a little bit about you and how you came to do what you do.
So I originally am a South Dakota, born and raised in Sioux Falls, and did undergrad at South Dakota State University. Did my medical school down in Omaha at the University of Nebraska Medical Center, and then did family medicine residency in Sioux Falls at the Center for Family Medicine. I've been with the Sanford Health Clinic in Brookings, South Dakota now for over 8 years, doing primary care.
You got here just in time for COVID.
Mm-hmm.
And you got to residency just in time for COVID.
Yep.
Yeah, so boy, life has been interesting for us all. So, Dr. Cook, let's start with the very basics. What is a vaccine?
Vaccine basically is a thing that we use to induce an immune response in a person.
Okay, so it can cover a lot of ground and exactly how that is done. So, Dr. Sands, I know that most people only see the end result. They see that liquid in that vial with that needle. What all goes into developing a vaccine?
It's a really long process. I think we had a different take on it during COVID, but it can be 10 to 15 years on average. It starts with some research. So a scientist decides or realizes the need for a vaccine for a virus or a bacteria. They do lots of research on the germ and figure out the best way to kill the germ and have your immune system attack that bug. So then from research, they go and develop. They try all sorts of different mediums and to figure out what the best way to attack that germ is. Once it's developed, then we have to test it. We test it from in the lab, maybe with some animals, and then eventually test it on a lot of people. And then finally it's approved and started to be distributed. So it's a very long process.
So what was different about COVID? Why were we able to do that so fast?
So we have different types of vaccines. We have vaccines that are using a live bit of the organism. We use an inactivated or dead bit of the organism. And now we have this new technology, newer, mRNA, which looks at the genetic coding, so what tells the bacteria to do what it's supposed to do. So these mRNA vaccines have really been in development for 15, 20 years. And the way that COVID was different was because we had the DNA, we had the genetic makeup of the virus. So the researchers were able to just take that little imprint and put it into the vaccine that was already made. So while it might have felt very quick that, we had this virus and a few months later, now we've got this vaccine and we're rolling it out to lots of people, it really is the product of many, many, many years of research and development.
And we were really lucky because the COVID virus was related to the MERS virus, which very closely related, which they had been researching intently. So they had an idea about what they could target, and they made that guess, and they guessed right. So there were just a lot of things that fell into line perfectly that we were able to get that virus. I thought they were nuts when they said we will have a virus or a vaccine by the end of the year. I thought there's no way on God's green earth.
And there's some people
it all came together. The stars were perfectly aligned.
And I've read some things that say it actually took too long to get the vaccine because we could have had this rolled out and in people's arms maybe in a month or so.
If we'd skipped the testing stage.
And ramped up production. But so we got it in arms remarkably quickly and right at the right time to kind of halt the progression of the pandemic in its tracks.
Yeah.
I think it's important to know that a lot of money was fueled all at once, and then all the steps, where usually it's sequential, all those steps all took part altogether then.
Right, and so there was a lot of factors that accelerated the ability to develop that vaccine in a way that most vaccines don't get. So, yeah. And we are seeing COVID, and if you haven't had your new shot, this is a good reminder, go get it. Dr. Sands, we were talking a little bit beforehand. Are you guys seeing people with COVID in the hospital down there in Sioux Falls?
Yeah, we do still see children come in with COVID infections, whether they're symptomatic or happen to have COVID and come in for another reason. But we're still seeing children with COVID, and they're in the hospital.
And, I think the message we got, especially early in the pandemic, was this is a disease that's dangerous to the elderly, but young, healthy people don't have to worry. Is that an accurate message?
Anybody can get sick from it.
Do you see kids get really sick, Dr. Sands?
I did, especially in the beginning. Now that there have been some mutations, children seem to be getting less sick. However, we still have kind of the complications and the after effects of COVID. I'm treating children for long COVID. We're still seeing bacterial infections after that COVID infection. So while the illness itself might be mild, you can still have complications. We saw a lot of MIS-C, or multi-system inflammatory syndrome, earlier on. So the way that I like to describe that is you get COVID, and then a few weeks later, your body just really kind of attacks itself, and it's just really inflamed. So we would see children with fever for 4, 5, 6, 7 days. They'd have red eyes, they'd have a rash, they'd have swollen lymph nodes, they'd have some GI symptoms. And it was really just kind of this autoimmune disorder that instead of the virus or the body was really attacking itself. And so kids were really sick. Thankfully, with some of these milder strains, we're seeing less of that, but it still happens. So, and we know that the vaccine has been fantastic at preventing the complications and including MIS-C.
And that is very similar to a condition called Kawasaki's disease that can be particularly serious because it can attack the heart of the affected child. Does MIC do that too?
Yes, it can affect the heart, and honestly, sometimes we saw it attack the heart more so than even Kawasaki did. So.
And we're also seeing that most people have some immunity, so the strains are milder, but we also have some better ability to fight it. So it's still an important disease out there.
And the studies do show that the combination of immunity. So we talk about active immunity from vaccines. So when we give a vaccine, our immune system recognizes that little bit of germ as foreign and actively attacks it, makes memory cells so that the next time the body sees it, it'll attack it as foreign and get rid of it a lot sooner. The same thing happens when you get an illness, but usually, like if you get COVID, you might be sick for 5 days, a week, 10 days, whereas if you get the vaccine, maybe you don't feel well for a day or so. But we have seen that combination of immunity from naturally getting the virus and getting the vaccine really prevents you from, gives you like an even better immune response and immune system to COVID in particular.
I definitely recommend getting the vaccine first before you get the disease.
Mm-hmm.
That's the best order to get things in. So, how do vaccines work in the body, Amy?
It depends on what kind of vaccine it is, but oftentimes, like what we talked about, you can use a vaccine that uses a weakened virus or bacteria or germ, and it's sent to the body to recognize, but it can't produce the disease itself. So then the body will mount an immune response, and then the next time that it's visualized by the body, it'll be able to attack it sooner. Some other vaccines might be inactivated or killed, or like a dead bacteria or virus.
Or a virus bit.
Yes, or the subunits or conjugate viruses, where it's just a little bit of the virus or the germ, and that's sent to the body to recognize that that's the bad germ that needs to be fought.
Okay. What do we mean when we talk about using a dead virus?
Basically, it's viruses aren't live, but it's an inactive virus that wouldn't be able to cause disease in a person. So it's not active. It's not going to be able to cause the disease or an illness, but it will be able to have the body recognize that as foreign and then provide some immunity in that.
Okay. We hear about doctors a lot talking about the vaccines preventing the disease. Is that the only reason that vaccines are important, Amy?
It's important to primarily, there's lots of different outcomes that we get. So oftentimes the primary outcome is to prevent the disease, but there are secondary outcomes, whether it is passing away or being hospitalized. In the case of COVID vaccines, we can try to prevent long COVID syndromes or those long-term sequelae from the disease.
Any other benefits to vaccines?
Yeah, one of them, especially in an outbreak or a pandemic, epidemic, if we get enough people vaccinated, we can help stop the spread of the vaccine, of the virus or the disease. And I think a great example of that is there was a Marburg outbreak in Rwanda in September that kind of made all the news, at least the ID news.
I was going to say, I don't even know what that is.
Made the infectious disease news. And it can be scary because Marburg is a cousin to Ebola. And we know that Ebola is very deadly, Marburg is very deadly. But the government, the scientists, were able to work as a community in Rwanda and the other surrounding countries, roll out a vaccine to the people who were at risk, and that stopped. It stopped the spread and did not venture out past the borders, and kept the numbers very low and the people who died very low. So that's an important role too.
Is the ultimate goal, really. So we often hear the term herd immunity. Amy, what does herd immunity?
That's referring to having enough immunity within a population to stop the spread of the disease or the germs. So it's putting those safety measures in so it doesn't spread like wildfire, and then it's not going to jump from one person to the next person to the next person. It's going to have less of that chance.
So just like you were talking about with that virus in Africa, that there were enough people that got protection from the vaccine that they kept it from spreading to other vulnerable people. It's a really important concept.
And it's also important because when you think of the herd, there are probably some people in your herd who can't get the vaccine, whether it's because of their age, they're too young to get the vaccine, or their medical condition, maybe they have cancer and vaccines are not good for them. So by the rest of the herd getting the vaccine and becoming immune to the virus or the bacteria, you're protecting those weakest, more vulnerable members of the population. And each virus or bacteria, the percentage that we need to have vaccinated in the community to achieve herd immunity kind of varies, but we think it's on the average of like 80 to 90%. Something like measles, which has been in the news a lot this year as well, is very highly contagious. We look at the goals in South Dakota is for 95% of the population to be immune or vaccinated against measles to achieve herd immunity. In 2008, 2009, 96% of kindergartners were vaccinated against measles with the MMR vaccine. That number has shifted down to 92%. So the lower we shift, the less people in the herd that are immune, the more vulnerable the entire population will be.
Are vaccines perfect?
No. Vaccines are far from perfect. We do know that some are very effective. The measles vaccine, when given on time, is like 97% effective at preventing illness. And the measles vaccine in particular lasts a lifetime. Others are not so effective, but don't necessarily need to be. But it's not perfect, but that's why we need more people to step up and get the shots in the arms.
Absolutely, a very good point. Therapeutic vaccines are currently at the forefront of a medical innovation. Prairie Doc spoke with Dr. Dilip Bhatt, a urologist at Avera Brookings, about prostate and bladder cancer therapeutic vaccines.
So in urology, which is my specialty, there are two cancers where vaccines have been developed. One is for prostate cancer and one is for bladder cancer. So the idea behind vaccines is that we introduce the vaccine into the body, so it makes the immune system of the body produce antibodies that will fight the cancer cells. So preventative is where you're trying to prevent the cancer from developing. Well, therapeutic is there already is a cancer, and you're stimulating the immune system of the body to fight the cancer, destroy the cancer.
Some vaccines are designed to prevent cancer from spreading further. Vaccines such as Provenge and Sipula-Cel-T specifically target prostate cancer that has metastasized to other areas of the body.
So the basic technique is that blood is drawn from the peripheral blood, and then they use called mononuclear cells. Those are cells that produce antibodies, and then they are extracted and then incubated in a solution. This one is prostatic acid phosphatase. It's a chemical. And then after incubating it with that, then is reintroduced into the patient. So it stimulates the immune system of the body to produce antibodies to fight the cancer cells. So, I mean, the results are not, I mean, fantastic or miraculous. It does cut down the amount of cancer. So there is one way that we check to see if the cancer is progressing or not is an enzyme called PSA, or it's called prostate-specific antigen. And from that level, we can tell how much cancer there is. So if you give the vaccine and then repeat those blood tests serially, we can tell, okay, is the PSA coming down or not? And from that, we can estimate, is it helping or not?
Bott says that the results of these vaccines can vary, with most showing only minimal change. However, they are approved by the FDA.
Because it's not so easily available, they would have to go to a center where they do specialize in that. And it's not very commonly available.
BCG is commonly used when treating bladder cancer, but distribution of the vaccine is often limited to larger facilities that specialize in treating this disease.
So the bladder vaccine is called BCG, which stands for Bacillus calmette-guerin. It was actually developed as a vaccine against tuberculosis. And so basically you're using live but attenuated mycobacterium, which is the bacteria that causes tuberculosis. Initially they tried it like a dermal into the skin, but the standard technique now is putting it into the bladder. So this is usually done for bladder cancers, which are not for low-grade cancers because there are certain side effects associated, but high-grade cancers which you think are going to continue growing or progress or spread. So, and again, it has to be done before it has spread or gone into the muscle coat of the bladder. So that certain stage of cancer, that's when we use it.
There are benefits to these vaccines, but it's important that patients are aware there are side effects caused by them and other cancer treatments.
As far as the BCG is concerned, there's been a lot of research done on that. And so right now they have come to a stage where they pretty much know when to use it, how to use it, how to look at the results, and when do you stop. Because say I took out a tumor, did the treatment, and then I would go back and the tumor came back, and I cut it out, and again it's another high-grade tumor. So I might say, okay, let's do another series of treatments. But if you see that it's not working, then you have to go ahead with the following treatment, because if you don't do it, the cancer is going to grow and spread, and you want to get it before it spreads. So then you got the other options, which are major surgery or radiation, chemotherapy, and stuff like that.
It's always so fun to me to hear about the ways we are harnessing the immune system to fight different diseases. Like he was talking about treating that cancer, melanoma. They actually had used the mRNA technology. Part of the reason it was so advanced when COVID came around was because they had been using it as cancer vaccines, and so they had a lot of development done ahead of time to that. So it's just fascinating to see what's going to happen. And I wonder how it's going to be different for our children. It's what kinds of things they'll look at and think, wow, was that primitive when we do that. So. Ashley, you were talking about the measles vaccine, and I got to thinking that there may be a lot of people in our audience who don't really know what measles is. What happens when somebody gets measles?
Yeah, a lot of people don't, and honestly, I have thankfully never seen a case of it because we had a vaccine that came out in 1957, I believe. So measles, it starts with fever, but it has a very characteristic rash that starts at your forehead. I've always seen it described as like pouring a bucket of red paint down the body, because that's the way the rash spreads from your hairline downward. We get some spots inside of the mouth, but you get a runny nose, red eyes. And for most people, I think that it was just a virus that took its course, ran its course. But there were a lot of complications, to include pneumonia, ear infections. A lot of people were hospitalized when they got measles, and then people died. So it was a good virus to develop a vaccine for, and thankfully we have seen those numbers really decrease with good vaccination.
And that's why it's important to keep those vaccination rates up. This is kind of flu season, and we're thinking about different vaccines. Amy, why do I have to get a flu vaccine every year?
We have to get the flu vaccine every year because the flu virus is very tricky. It has a tendency to change itself year to year, and so the vaccine from last year isn't going to take care of the virus this year. So we do have to get the new vaccine so we can try to stay on top of the virus that's going to be circulating for the present year.
Are there different types of flu vaccines?
There are. So we talked a little bit about inactivated versus live vaccines. So the most common vaccine that you think of with the flu and that the majority of people get is the inactivated virus, a shot in the arm. But there is a live vaccine that you can give in the nose. And that is good for some folks who are maybe needle phobic. But the chance of that you could spread a little bit because it is a live vaccine. So if you have a family member who maybe has a lower immune system or is fighting cancer, that's not a good choice. It's also not a good choice if you have asthma. So we do have different options for the flu vaccine itself.
Excellent. Another vaccine that's kind of in people's minds at the moment, there's a pertussis outbreak at the moment. Ashley, what's pertussis?
Pertussis is whooping cough. So it is another virus, or bacteria, sorry, Bordetella pertussis, that can be spread by coughing and nasal secretions. And it's a little tricky because for the most part, the first few days, week or so, few weeks, is a runny nose and maybe feeling bad, a little fever. And then 3 weeks into the illness is when you get that kind of distinct cough. And unfortunately, you are contagious from the very beginning, not just when you have the cough. So we are seeing an outbreak of that in South Dakota and across the country. We see kind of these cycles every 3 to 5 years where our pertussis rates go up. And so we're just seeing it now.
Amy, what can we do for pertussis?
It's important to get vaccinated. The pertussis is typically in the vaccine with the tetanus vaccine. Kids are routinely vaccinated against pertussis, and pregnant women should get a Tdap shot between 27 weeks and 36 weeks gestation for every pregnancy. And if you have a newborn or a soon-to-be newborn, you should look to see your vaccination status too.
Yeah, if there's going to be a baby in the household, you want to protect that baby. My father was born before the pertussis vaccine and nearly died several times from it. So it is a disease that was and could be extremely dangerous, especially to little people. Other shots that we might talk about for children, hepatitis B. Why is hepatitis B important? Amy?
It's a virus that can affect the liver, and I believe globally it's the #1 reason for liver cancer, hepatocellular carcinoma. And we vaccinate children for it now, I think since the mid-1990s or so. But it's still important for adults to get it, especially if there's issues that could come down with the liver, or if you're traveling to a place that has hepatitis B virus that's more widespread than what we currently see.
Are there any other hepatitis viruses that children might get immunized for?
We vaccinate against hepatitis A. Starting around 18 months, and that's a 2 vaccine series. And that one prevents really bad GI infections. So we don't see a lot of hepatitis A in the United States, but we do see a lot of it outside of the United States, especially in travelers. So it's important to get it before you have the exposure. And a lot of people might think like, oh, especially like rotavirus too, just a GI bug. Like I can be sick for a couple days and no big deal. But again, in young children, it can lead to dehydration and hospitalization and death. So it's important to get these vaccines.
I'll usually tell travelers especially, you'll probably get over hepatitis A.
Right.
Can make you super sick, but it's not common to die from it. But do you really want to spend 2 weeks of your vacation that sick?
Right.
I don't. Spent too much money on that vacation. I don't want to be sick for it.
No.
So, and then there's another vaccine out there that maybe is a little controversial. The HPV vaccine. Amy, what is that vaccine all about?
Oh, that's a very exciting vaccine because it
is.
helps to prevent cervical cancer and other cancers. So it's so exciting to see the drops in cancers with a vaccine. HPV is a human papillomavirus, which typically is spread by sexual contact, so that's where the controversy comes in. We vaccinate kids as young as 9 years old, and we want them to be vaccinated before they would be exposed to the HPV virus, so that would hopefully catch them before they become sexually active in their later years and when they're having a good, strong immune system to react to the vaccine.
And how many shots is that?
It depends on their age, but typically if they get it right away when they're kids, you can get 2 shots. If you wait too long, you have to get the 3 shots.
And what happens if I forget about coming in to get my shot? Do I have to start all over?
No.
All right, excellent. So, then there is a vaccine that maybe is a little more both to kids and adults, the pneumococcal vaccine. What do we know about that for kids? Why is it important for kids to get the pneumococcal vaccine?
It's very important for children to get the pneumococcal vaccine. So what that is preventing is illness with Streptococcus pneumonia, a bacteria that very commonly causes ear infections, sinus infections, and can cause bacterial meningitis, so an infection around the brain and the spinal cord. Before this vaccine came out, the first one came out in the early 1990s, there were lots of streptococcal pneumoniae meningitis kids in really young, or meningitis in really young children and babies. So that is also a multiple dose series as an infant, and then again as the child is a little bit later, a few more during like the preschool age. Yeah. So since we've seen that vaccine come out, we've seen those strep pneumonia, meningitis, ear infections, pneumonia also really decrease. And then we keep having more and more serotypes. So there's many different forms of strep pneumo. The most recent vaccines have 20 types that will prevent against the most common, but also the most invasive or the most pathogenic, deadly strains of that bacteria.
Who else might get that shot, Amy?
Other than kids, it's important to anybody over the age of 65 should be getting the vaccine, and other people who may be at risk with lung disease, so people with diabetes or smokers especially.
People with cochlear implants, for example, should get it. And they just came out and lowered that age. So people 50 and above are eligible for that vaccine just as a matter of routine. So, yeah, I know what I need to be doing here. What other vaccine might an adult need to think about that maybe we don't think about for kids?
Well, we talked about potentially the chickenpox vaccine is for kids, but then once we're adults, then we're eligible for the shingles vaccine once you turn 50.
What's the connection between shingles and chickenpox?
It's the same virus. In children, you'll see a widespread rash. I have the photos of myself in my, I think, strawberry shortcake bathrobe with calamine lotion all over my face. Again, a viral illness with runny nose and things. But the way that the chickenpox virus works is that it sets up in like nerve endings. So in adults, we see shingles, which is, or also in immunocompromised children, you'll see shingles. So you'll see a rash, like just in a line, maybe across your rib cage or by your face. And that's just that virus reactivating and causing this very incredibly painful rash.
So it's not something you want. Get your shots.
No.
Yeah. While getting ready for college, it's never a bad idea to schedule a visit with your primary care doctor before you send your child off on this new adventure. Dr. Jonathan Michel, a primary care physician at Avera Brookings, speaks on the importance of vaccines at this stage.
Apart from the rules, they're important because college has a couple things. But the biggest thing is that there's lots of people living in close proximity in the dormitories, and there can be communicable illness. And so being protected against them for yourself is helpful, and also ideally not spreading illnesses around to other people is nice. So for those reasons, vaccines are required and recommended before going to college.
Colleges and universities across the country require a measles, mumps, and rubella vaccine, but it is also recommended to receive a hepatitis or tetanus shot, even though they may have received one as a young child.
The biggest one that's important for college that we get later or before we go, let's say, might be an immunization against meningitis or meningococcal vaccination. So those would be some that are important to have before.
Seasonal respiratory viruses can be prevented by receiving a flu or COVID shot. These can be administered throughout the cold and flu months.
So we think a vaccination against hepatitis A is recommended before going to school. That's an immunization that we're giving more commonly, but maybe 10 or 15 years ago it was optional. And so for anybody thinking about studying abroad, immunization against hepatitis A might come up. And so at the end of the day, stopping in to see your pediatrician or family or primary doctor before going to college can be helpful to make sure you're up to date with required and also recommended immunizations, and certainly because you're going to be including an immunization record with your application or in that process.
Dr. Moschel says that college students or individuals transitioning to independent living should maintain a record of their immunizations as part of their health history.
So between us and Dr. Michel, we've kind of talked about a lot of the common vaccines that you and I give in our offices every day, and to prevent diseases that we don't want you to have to try to treat later on. But some people get other vaccines, like travelers. Why would a traveler necessarily need to get something different?
Yeah, that's a great question, because not all areas of the world have the same diseases. We think about yellow fever and Japanese encephalitis. We don't see those here. We're not in a tropical environment for the most part in the United States. So people traveling to different areas of the world would want to protect themselves against those viruses that are more common in that part of the world that they're going to go visit. And like you said earlier, if you're going on vacation, you've spent all that money to travel across the world to Japan or South America, I don't want to spend my 2 weeks there in a hospital or in my hotel room at my resort. So get the vaccine before you go. And
can I just stop in on my way to the airport and get my shot?
So vaccines your immune system needs a little lead-in time to really get boosted and make sure that you're prepared before you might see something in the wild, so you say. So really 2 weeks beforehand. You should be, at least 2 weeks beforehand, you should try to reach out to your primary care provider, us in infectious diseases, make a little travel clinic visit. We can talk about the illnesses that are common in the areas where you're going, where you're going to be staying, how long you'll be there. And it's not just about vaccines. We can give medications for malaria, and we can talk about other things that you'd encounter. So reaching out and making sure that you get that visit in as part of your travel checklist is a good idea.
Yeah, sometimes the earlier the better. When you make your plane tickets or make your reservation, maybe also make an appointment at the travel clinic, because some of those things require quite a bit of lead time, some of those vaccines. And if they don't, you can always come back and get them later, but if you are too late to get them, they're not going to be nearly as helpful.
So. Especially yellow fever might not be in everybody's clinic. We might have to reach out or make sure that we order it in advance so that we can give you that vaccine. Make sure we have the malaria pills in the pharmacy. So
yeah, there's some advanced planning that you need to do, and some knowledge about exactly where you're going and where you're going to stay, because if you're staying in the capital city, your risk is going to be different than if you're out in a more rural countryside. So Amy, what kind of reactions can I expect to the average vaccine?
If you're getting a shot vaccine, oftentimes you can get the local reaction. So people always think about the pain associated with the injection itself. Some people will get a little bit of redness around the injection site, maybe a little bit of a sore arm or a sore area where it was injected at. Some people may get a little bit of an immune response, so thinking of like a little bit of body aches, maybe a low-grade fever, maybe a little bit of a runny nose, feeling run down for a day or two.
Okay. Are there some vaccines that are more problematic than others from that standpoint?
Yes, oftentimes we think of like the tetanus shot causing a little bit more of a sore arm, and then from my experience, the hepatitis vaccines tend to be more forgiving with terms of side effects, whereas more of the live viruses, you might get a little bit more of a side effect with those.
The one I get lots of complaints about is the shingles shot.
Very true.
Yeah, not something you probably give a lot of in your population, but yeah, I've gotten taken off a lot of Christmas card lists for giving people the shingles shot. So yeah, let's talk a little bit about RSV, because that's a new and very exciting, at least to me, it's a very exciting thing.
It's very exciting.
So what makes the RSV vaccine unique?
So there are 2 different types of, I like the quote-unquote vaccine. So for adults, our older population, grandparent age.
Pregnant women.
And then pregnant women, they'll get a vaccine. So it will do the same kind of typical vaccine response where your body will build an immune response to the virus. So when you do see it, if you do see it, your illness is a lot less. We have fewer complications, fewer hospitalizations. For infants, and then we also vaccinate pregnant women so that they can pass some immunity to the infant while the baby's in utero. So the baby is born, hopefully, with some immunity to RSV, because we know that RSV is really the most problematic, worst for our real young infants, less than a month of age. That's where we see babies have like pauses in breathing and get hospitalized. For our brand new infants whose mom didn't receive the vaccine during pregnancy, we have an antibody. So we call it a vaccine because of the way that we get paid for it. And by get paid for it, I mean that the insurance company will cover that vaccine cost for the patient. So it's not a vaccine in the typical sense. It's, instead of the infant's body building the antibodies, we're just giving the antibodies to RSV to those infants. So it's very exciting for me as a pediatrician first, and making sure that we keep these fresh newborns out of the hospital, because we don't want them to get ill. We don't want them to have fevers and need to be hospitalized.
Or have low oxygen levels, or stop breathing, or any of the awful things that I used to see for RSV in young children.
And we still see it.
And getting dehydrated.
Yes, not being able to eat because they're working too hard to breathe. And you're right, we still see it. This is just something, last year was the first year we had this widely available. And however, even before that, we were doing something similar. Can you tell people a little bit about that? Synagis?
Oh, yes. So Synagis is another monoclonal antibody, or an antibody that we would give to infants who were high risk. So infants who had a cardiac defect or a bad lungs, maybe premature infants in particular. And this was a monthly shot. And it was also very expensive, and worked okay. But we were only giving it to that small subset population, those infants who are really at like extreme high risk of having complications from RSV or getting hospitalized from RSV. So now that we have nirsevimab, every infant can get it in their first RSV season, which we typically think of as October to March or April. So that really kind of broadens the number of infants that we can protect.
And to only get one shot instead of a shot every month is just really, so it's, the point that I wanted to bring out with that is this isn't a new concept.
No.
This is a well-established concept that we've been doing my whole career. That's a long time. It's just that we have an improved version that is more widely available and less expensive and can benefit more babies and families.
Exactly.
It's a wonderful thing.
Yeah.
So, Amy, one of the issues that seems to come up a lot is the idea that vaccines cause autism. Is there any truth to that?
No, it's been debunked numerous times, many studies. There was a physician who had fraudulently made a claim, I believe it was out of a very small study of like 12 individuals, that they showed behavior changes after getting the MMR vaccine, but there was no evidence really. It was a fraudulent study that was had some potential gain for monetary value for the individual who was doing the research, and we have debunked it, but we still see that effect of trying to undo the misinformation.
What does cause autism?
It's a great question, and we don't really know fully. We know there are some genetic causes of autism. There might be, we really think that it's a multifactorial problem. So a lot of it is genetics, but maybe there is some environmental, but we know that it's not vaccines.
Yeah, that's a good bottom line. What we do know is that it's not vaccines. So, how long do vaccines last, and what's the science behind needing a booster every year?
It depends on the vaccine. So like we were talking about, whether it's a live vaccine or an inactivated vaccine, each of them have different ways that it can boost your immunity. So it really depends on whether you need one shot, two shot, or multiple boosters. And that's where the many studies and the trials come in, and then the long-term studies that we do also too, to watch over time, which I think the RSV vaccine is going to be the big thing that we're going to be seeing. Currently, it's just a one-time vaccine in adults, but in the future, we may need a booster for that.
I think, you know, when I think about my own career, the chickenpox virus vaccine was like that. When we started giving it, it was one shot, and now there's a booster at kindergarten, and maybe there will be boosters like the tetanus shot every 10 years, and maybe currently the recommendation is that adults get one lifetime booster with the pertussis. I think that's going to change. So it's something that we are always watching and revisiting and asking questions. So it's not a done deal. Can you get vaccines if you're pregnant? And if so, are there some that you shouldn't get? Amy?
Yes, there are definitely vaccines that you should be getting. As a pregnant individual, you are at high risk if you were to get flu and COVID. So during COVID and flu season, you should be getting those vaccines. Like we talked about, the tetanus shot is given for that pertussis or whooping cough, protection between the gestational ages 27 to 36 weeks, and then we start to do the RSV vaccine between 32 and 36 weeks.
During RSV season. So.
And then there are some vaccines that we can't give. We still test for immunity to rubella, but that's a vaccine that is a live vaccine, and we don't give live vaccine to pregnant individuals.
What happens if somebody gets rubella and they're pregnant?
So it's another thankful thing that I have not seen before, but we know that rubella during pregnancy can cause congenital rubella of the fetus, the infant. It can lead to something simple as rash. It can lead to hearing loss, blindness, cardiac or heart defects, and can lead to stillbirth and death. So making sure that you're immune before you're considering becoming pregnant is a good thing to do. And then otherwise doing your best to keep away from illness during pregnancy is really best.
It's really fun to sit here and talk about the things that we don't see anymore.
Yes.
Because of vaccines. Let's keep it that way, everybody. We'll be back after this.
Grab a copy of your local newspaper or read online the Prairie Doc Perspective, a weekly health and medical column. Head to prairiedoc.org to access all archived columns today.
Thank you to our guests, Dr. Sands and Dr. Cook, for volunteering their time to help us learn more about vaccines. If you would like to see and hear more episodes of this program, please like and follow us on Facebook, Instagram, Threads, YouTube, and TikTok, or visit us at prairiedoc.org. Look for Prairie Doc Perspectives in your local newspaper and online, and listen to us on Prairie Doc Radio on South Dakota Public Broadcasting, Sundays at 6 a.m. and 1 p.m., and be sure to look for the podcast of this program, Prairie Doc On Call, wherever podcasts can be found. From all of us here at On Call with the Prairie Doc, thank you for joining us for another episode of health information based on science and built on trust. Until next time, stay healthy out there, people.
Most know good nutrition and physical activity help maintain a healthy weight. The benefits include keeping energy levels up and protecting against many age-related illnesses and diseases. Eating to improve your health. Next time, On Call with the Prairie Doc.
My name is Dr. Tad Jacobs, and I serve on the Healing Words Foundation, the nonprofit that runs Prairie Doc programming. Our mission is to enhance health and diminish suffering by communicating useful, science-based information respectfully and compassionately. Your donation supporting Prairie Doc programming makes an extraordinary difference. Gifts of any size enhance its impact in our state and beyond. Thank you for your generosity.
Major funding for On Call with the Prairie Doc has been provided by
At Avera, our nationally recognized health system will be right here with you, with care and coverage. Hello, possibility. Hello, healthy. Hello, life. Avera, moving health forward.
Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information. And with the ongoing support of these individuals and institutions, Brookings Health System, South Dakota Academy of Family Physicians, Ophthalmology Limited, Avera Medical Group Brookings, Avera Heart Hospital, First Bank and Trust, Dakota Allergy and Asthma, Monument Health,